Minnesota nurses spoke out at a legislative hearing yesterday about safety concerns while on the job. Right now, nurses across the Twin Cities are protesting lack of personal protective equipment. Here's a live look of nurses outside of United Hospital in St. Paul. In about an hour, they tell us they plan to march from United Hospital to the state capitol to deliver a pandemic Bill of Rights petition with more than 10,000 signatures. Our John Lordson shows us how one healthcare system is responding to the nurses' PPE concerns.
The things that they're asking us to do today, if I would have done 3 months ago, I would have been fired.
Brittany Livacari points to Cliff Whelming, a fellow ER nurse who was fired for violating United Hospital's policy when it comes to wearing hospital scrubs. She says both the quantity and quality of personal protective equipment are a problem. And Wednesday's protest is about allowing frontline nurses to be a part of the solution.
I hope that this puts a little bit of pressure on Alina to go ahead and provide us the proper PPE, but more importantly, to just include us in some of that decision-making process.
While nurses say more is needed, Alina says they are listening.
Today, we're launching sort of a new look and feel to PPE transparency across the system.
Mallory Koschel is Director of System Safety and Quality for Alina Health. She says their PPE dashboard program is a tool they're using to look at what's been used and what's projected to be used as far as respirators, gowns, and gloves, and then resupplying where supply is needed.
And it's ensuring that we can not only keep our staff safe today, but through the duration of the pandemic.
Koschel says Alina has also launched a PPE champion program. So far, 500 employees are a part of this. Their duties are to support frontline workers about what type of equipment is best for which patients or scenario. Allison Starkey volunteered to be a PPE champion.
Things change rapidly, and so we're always trying to stay ahead of the latest guidance from the Department of Health and the CDC.
We're demanding protections, so we want the highest level of PPE so that way we're protected and we're not giving this to our community and our family.
John Lordson, WCCO 4 News.
Alina also says it has changed workflows to optimize safety. It says some of those changes include physical separation of respiratory and non-respiratory care spaces and clearly marked zones within emergency departments.